Ms. Lesko, you're recognized.
Thank you, Mr. Chair. And this is a great discussion because the purpose of this committee, from my understanding, is to try to learn from what we did right and what we did wrong, so when the next pandemic comes along, we're not going to repeat it, hopefully. So my first question is for Dr. McCary. In October 2020, Rochelle Walensky, who would later become CDC director, co-authored a memorandum published in The Lancet that stated, quote, "There is no evidence for lasting protective immunity to SARS-CoV-2 following natural infection," unquote. Was there any data at the time that would have supported her statement or refuted her statement?
Well, first of all, the absence of evidence is not the evidence of absence, and she should have known that all other viruses yield natural immunity with ultra-rare exceptions, including the 2 other coronaviruses that cause severe illness in humans. Both were studied to have long-term immunity. So I think it was intellectually dishonest, but even worse, she dug into her position as the data were overwhelming, even to this day. The Yokovich doctrine, in place yesterday in America, prevented teachers at federally funded schools from working. We won't allow people with natural immunity to work unless they have the full vaccine primary series. Well, guess what? We're hurting children from ignoring natural immunity. It's not historical. It's not looking back and blaming. It's right now. 160 schools in Missouri have gone down to a 4-day school week because they don't have enough teachers. They've left. Hospitals are understaffed. Response times are longer for first responders, not because of a historical mistake. They're still ignoring natural immunity. Even at my university, you can't go to school without the primary vaccine. Even if you've had COVID 3 times and we're in the ICU with myocarditis, you still need to get the COVID vaccine. That is intellectually dishonest.
Thank you. That's very passionate, very appropriate, because our last hearing we had was about school closures and how that adversely affected students. You know, did you bring this up, and I haven't done the research, so did you bring up the natural immunity, and were you shut down? Were you censored?
I was not censored. I always cited data, but I can tell you that natural immunity was considered misinformation by our public health oligarchs as they spread their own misinformation on many other topics.
In a related question to all three of you, in the early stages of the pandemic, do you believe that federal public health officials were aware of the centuries-old knowledge of infection-acquired immunity?
Yes, they were definitely aware of that, but even if they thought SARS-CoV-2 was different, certainly by mid-2020, there was a lot of immunological data showing that recovered patients had a very robust B-cell and T-cell response, and they were seeing that it was lasting over many, many months. So they did, and it was very similar to the T-cells that were made by SARS-1 that were still reactive almost 20 years later. So yes, I think they knew early on that natural immunity was strong.
I think they knew that there was some natural immunity. I would imagine that the question they were asking is, how much do you need to be protective? And, you know, at the time, because there was so much disease going around, they had to make very difficult decisions as to what was going to be beneficial for the majority of the individuals.
Did you want to add anything?
If I could just add, because in my role as editor-in-chief of MedPage Today, the second largest trade publication read by doctors in the first 2 years of the pandemic, I asked, has anyone seen a healthy person who's recovered from COVID show up in an ICU? The answer was always no. Maybe there's somebody out there, but by and large, it protected against severe disease in the first 2 years. It was always right in front of our eyes. Saying we don't have a New England Journal of Medicine study where the editors are your friends and they called it misinformation, that was establishment group think. And the reality is we always knew those precious life-saving vaccines should not have been going to people first in line, already immune with natural immunity, as thousands die a day. So it wasn't a philosophical point. Thousands of Americans died from natural immunity, and over 1 million people left the workforce, and we are still suffering in schools, in hospitals, in all sorts of settings because of that ignorance, and they still have not issued any kind of apology, rehiring, or back pay in the vast majority of those instances.
Thank you, and I yield back.